Yo, today we go from a crooked smile to a straight smile. We have a successful business coach in his 30s wanting a better smile. Gentleman does not want to have braces and has already tried wearing clear aligners before with no success. He says that due to his speaking engagements, he is unable to tolerate wearing clear aligners. So he is wanting crowns to correct his smile. Here is a mirror reflection showing his upper teeth. Our limitation is that we are not able to move the position of each tooth in the upper arch jawbone. However, we can prepare the teeth and design the crowns in a way to make the upper teeth appear aligned in the upper arch curvature. So, here is the result. We have made the canine teeth on either side more even in length, and we have made the premolar teeth on either side more visible in the smile. The front side tooth on the upper right hand side appears better aligned next to its neighbors. All right. The original situation had teeth poorly positioned in the upper arch curve. As we can see here, all right, the teeth are out of position. The new crowns have allowed for the upper teeth to appear in better positions in the upper arch curve. So we go from crooked teeth to teeth that appear less crooked with the crowns, better aligned in the upper arch curve. And our patient is over the moon happy. Our business coach is broadcasting with even more confidence. Thanks for watching. Please like, subscribe, and follow Smile Makeover Volume 33 with Dr. Richard.